Well, welcome back, everyone. I'm Ben Glass. This is the Live Life Big podcast where I get to interview really interesting folks in our community. This morning, I have with me Dr. Candace Bryan. Dr. Bryan is a neurologist at the Neurology Center of Fairfax. I was saying before we went live, we have a lot of clients either in our automobile practice or in our disability practice who have seen you, and you have, I think, 6 or 7 physicians, it seems like.
Quite a few, 12 of us altogether.
It's a long-running, substantial practice here with locations in Fairfax and Reston and a sleep center, I think.
Correct.
Also in the Fairfax area. But I wanted to get you in because congratulations, Washingtonian magazine, Best Doctors again.
Thank you.
Yeah, I mean, that's a real testament to not only your peers recognizing you, but also what patients saying, what the community says about you. So thanks for coming by.
Well, thank you for inviting me.
Tell us a little bit about your background. Like, how did Dr. Bryan get to be Dr. Bryan?
Well, I always knew that I wanted to be a doctor, but
That's cool.
did not know that I wanted to be a neurologist.
Yeah.
I firmly went into medical school thinking I'm going to be a pediatrician, and that's what I will do. And I was going through my clinical rotations, and one of the first rotations I went through was psychiatry. Fascinating field. That was not for me. My second rotation was neurology, and it was an absolute fit between my interest in medical mysteries, so to speak, taking comprehensive histories, and the longitudinal aspect of care with many of our neurology patients.
I'll just stop there. That's a really important point, is that, okay, so you knew you wanted to be a doctor, but I talk to a lot of young folks, high schoolers, college students, who don't know what they want to do,
Right.
and yet, I always tell them, take a class in something you don't know anything about.
Right.
You got exposed because of the rotations,
Right.
and oftentimes you'll find somebody like, oh, this is it. Like, really? I can do neurology?
Exactly.
Like, this is very interesting.
Exactly.
So cool. So did you grow up around here? Or?
I did. I grew up in the Northern Virginia area. I'm a Mount Vernon High School graduate, so
Oh, cool.
yeah, native to the Washington, D.C. community.
And then med school?
Med school, I went to the University of Pittsburgh, so I did leave the area a bit, but I stayed undergrad at the University of Virginia.
Oh, wow, that's cool.
Yeah.
What do you say to young folks? Again, I get a chance to talk to high schoolers, college students, about the medical field. Someone says, Dr. Bryan, boy, I think I want to be a doctor. Is that, what do you say to them? Like, no, or pursue your dreams?
Oh, absolutely, pursue your dreams. Medicine is phenomenal. It is such a varied field, and there are so many roles for people depending on what their interests are, not just in the fields of medicine, but medicine is becoming even more technologically based.
Yes.
So if someone wants to marry a love of technology and an interest in people and a compassion and an empathy, there are roles there for that in medicine. So I absolutely say pursue it. But understand, this is a long haul.
It is.
And
it's a real long
and
haul.
it is a commitment. And it's a commitment that means for many people there is some sacrifice involved. But I do think if you have a love and a passion, it is absolutely well worth it.
I would think, so one of the principles we live by here is, for everybody, from the lawyers all the way up and down the chain, is, to be a forever learner, to be curious always.
Absolutely.
You and I were talking about our mutual love for podcasts and long-form
Absolutely.
podcasts, and you mentioned sort of the true crime mysteries and figuring stuff out. So I
Yes.
think neurology is a perfect place for that. Tell us a little bit about your practice today. What sort of patients are you seeing? What sort of illnesses and diseases are walking through your door and you dealing with?
Well, I'm a general neurologist, and so I see a large variety of neurologic diseases, and that really encompasses diseases of the brain, and so those might be conditions like migraine headaches or conditions such as like various types of dementias or certain movement disorders, but also conditions that involve like the nerve and muscle, including conditions like peripheral neuropathy. So it's a very varied profession. I see a lot of different things in my field.
Well, it must fit your DNA perfectly, because somebody comes in and they have a litany of or symptom complex or complaints, and you're trying to figure out just which one of those things we just talked about is it. I mean, is this really involving, is the real problem the brain, something misfiring there, or some nerves, or is there a chemical imbalance? So
Exactly.
so that's cool.
It makes for endless fascination, and it's always interesting because it's still a very strong physical examination neurology, and so you're always trying to localize based on symptoms and physical examination. So really kind of puts to the test your examiner skills, your physician skills, so it kind of marries all of that together.
Do you find in today's environment where, as we talked before, there's a lot of pressure from insurance companies and stuff, but are you finding in your practice that you have the time to really spend with patients to do your mental investigation and your technological investigation?
Right. I mean, I certainly make the time. To some degree, patient experiences could be shorter and they could be more rushed, but I really try to make sure I take the time with patients. I find that when you're able to take the time, people are able to convey all the information they need to help with making a good diagnosis. And I also think it helps with me being able to educate patients appropriately about their conditions and treatment, because there are a lot of constraints on physician time these days, but you really have to, as much as possible, make the time that you need to be with the patients.
So let's talk. I know that one of your you do a lot of things. One of your sort of favorites or things that you're known for in the community is the dementia, right? And this is important to a lot of people my age, because we are oftentimes we're parenting our parents.
Yes.
And so you have a population in their 80s or 90s, and we wonder, well, two things we'll talk about. One is helping a parent through that process.
Yes.
And then we'll talk about what we who are younger can do to delay the onset of any sort of dementia or cognitive dysfunction so that we can live our lives fully.
Right.
So let's talk about that, for this discussion, that parent who may be showing signs of even just forgetfulness, or sometimes we call it, old age.
Right.
How does the family, do you think, best go about trying to figure out, is this something that's serious or not? And if so, what's the path? At what point do we talk to somebody like you? Talk to us a little bit about that.
Right. I think at its heart, the best thing is really to trust your own intuition. If something seems off, and with repeated interactions with someone that you know well, it's better to get it checked out than let it be. And I think some of the signs are forgetfulness, but to a degree where it is in regular conversations, one is noting maybe repetition of certain thoughts or questions are coming up, and someone's having a difficult time just in their day-to-day activities like getting their bills paid, managing their medications. And so I think if you're noticing things and it doesn't seem right, it's good to get it checked out. And I'd say the first step is really a good physical with your primary care doctor. Sometimes it may be there's a medical condition going on. It could be that there is a problem with a medication that needs to be adjusted. So I would say that's a good first step.
Okay, and then as we sort of walk through this, so let's say someone presents to you, talk to us a little bit about what goes on inside your head. Now, they've been to the general practitioner, they maybe have ruled out sort of easily correctable metabolic imbalances, drug interactions, things like that. What are you looking for, and how much help can a neurologist actually be for someone who is progressing through some form of dementia? First, like when we talk about dementia, what is the definition?
The definition of dementia is a condition of the brain that impacts your functionality in various domains. Most commonly, that tends to be memory, so short-term memory, but it also affects your ability to navigate the world independently as an adult. So that might impact your ability to navigate when driving, to manage your finances, schedule medical appointments, all of these things that make you capable of getting around independently as an adult.
Right.
When I see a patient and I listen to their history, I'm also listening to those around them who see them every day. So whether that be their spouse, their child, a good friend, but someone who knows them, has history with them, and I'm trying to get a sense, what's going on? What are the symptoms that you've had? How long has it been going on? And how impactful is this to you in your activities of daily living?
Sometimes you have that tension the person who is the patient
Yes.
maybe doesn't self-perceive or appreciate, or maybe does but is in sort of denial, and you've got maybe spouse or other family members saying, no, it's actually worse. So talk to us a little bit about open and honest discussion, what's best from your point of view,
Right.
and how should family members deal with the sort of reluctant patient?
Right. Well, I'm very glad you asked that question, and it also loops back to kind of what is the role with the neurologist. I think the key is that people, if they have a medical condition, they want to know that it's being accurately diagnosed and
Right.
that they're getting the appropriate information. So I think the role of the neurologist is really to give objective scientific information to say, we've done evaluation and testing, and I can say unequivocally there is a problem, or I don't think this is a problem, I think this is just normal aging. So I think the idea is if you're coming in with a loved one and you're not certain if they have a problem, the burden is not on you to prove that. Really, it is to bring in your concerns and allow a person like myself, a neurologist, the professional, to make recommendations for tests and evaluations, and based on that, make a determination of whether or not there is a dementia process. And so I think that's a strong aspect in terms of seeing a specialist, is to really be confirmed about the diagnosis. I would also say if you have a reluctant family member, the idea is dementia is a disease like any other disease, high blood pressure, diabetes, and people do better if they know what their diseases are and they're proactively treated. So if you treat this like a disease process and you address it and you're proactive, typically people will have better outcomes.
And I assume, because better outcomes includes, hey, there's medication regimens, there may be other therapies that can help either work around the issues the dementia is causing, or even, I think in some cases, alleviate symptoms for some period of time. Tell us about what's
Correct.
new in
Correct.
neurology and dementia.
Well, there isn't a lot that's new, but there's a lot hopefully on the horizon
That's
for
cool.
care,
Talk about
which
that,
is
yeah.
exciting. But at the present time, there's a lot of clinical trials focusing on there are proteins that are depositing in the brain and they're causing dysfunction of the brain. And so medical trials are focusing on trying to stop the progression of those proteins. So it's promising, but it's slow going. Current therapies are really designed to try to minimize some of the symptoms of dementia, which can range from memory problems to confusion to difficulties with organization and sometimes mood. It's an under-recognized symptom, but uncharacteristic irritability, depression, these also go along with that. And so for quality of life purposes, it's really important to recognize and, if appropriate, to treat that as well.
Yeah, that it must be, we talk about mood for a moment, it must be frustrating, when someone begins to feel like their memory is failing, or there's other sort of mental acuity decreasing function,
Right.
and yet they still, they may be otherwise healthy. They may be,
Absolutely.
their body might be in good shape. Talk to me for a few minutes about, because you used the phrase normal aging.
Correct.
So what does that mean? What is normal? Like, what is the pattern that most of us who are healthy can kind of expect to happen as we age?
Correct.
And then we'll come back to what can we do to live life longest, best, fullest in a minute. But normal aging, what's that?
Normal aging would be things like occasionally forgetting a word or a name, a street address that one knows. Sometimes walking to a room and forgetting the purpose of why you walked into the room, and remembering that shortly thereafter.
Sometimes you have to walk back
Yes.
to, go back over here, and now I remember.
Right, exactly, in order to prompt those memories, and even an occasional lapse like, I forgot a bill, I paid something kind of late. Those things are not uncommon. Sometimes multitasking can be a bit harder when one gets older, but generally with those things, they're individual, instances. They're not necessarily every single day. And again, they're not impacting your ability to, if you're at work or volunteering or involved in your community, they're not limiting your ability to do those kinds of things.
I know that you are big on healthy living, healthy lifestyle, healthy habits.
Correct.
So so I just turned 62,
Okay.
right? And so for those of us who want to be able to live independently as long as we can, to be there for our grandchildren and maybe great-grandchildren, what are those discussions? What is your teaching on that?
Well, I'm very glad you asked that, because these are very straightforward things. I think these are things we should all be doing throughout our lives, but particularly as we get older, these are important things to make sure we're doing regularly. So there are 4 things altogether. So the first thing on the list,
like lists.
I love a
Yes.
list. The first thing on the list is regular exercise.
Yeah.
So regular exercise has so many different health benefits, but it absolutely has a benefit for your brain and cognitive health. And exercise does not have to be arduous. Exercise should be incorporated into your lifestyle, things you like to do, just finding ways to be more active.
Right.
So it should be something enjoyable and sustainable. So that's number 1. Number 2 on the list, Mediterranean style diet, or a heart healthy style diet of eating.
Meaning what?
Meaning, if you have a diet that's rich in fruits and vegetables, whole grains, healthy fats, lean proteins, with minimizing of red meat, and lots of spices. So your cumin, your
Oh,
turmeric,
that's cool. Yeah.
your cinnamon, all the good stuff. These are yummy, healthy diets, and in many ways they're not really restrictive. It's eating in abundance, healthy, fresh foods.
Varied.
Yes.
I would describe that as like planning your shopping.
Yes.
Giving a little thought before you head into the grocery store.
Absolutely.
And a lot of the books I read talk about buying from the perimeter of the store, because that's where all the fresh stuff is and all the processed stuff is down the aisles.
Correct. Yeah, planning your shopping trips. Number 3 on the list is engagement. And so social engagement in your community, with your family, with your friends. Social isolation is associated with later life cognitive decline.
A lot of science, I think, I recently read something about loneliness being as bad potentially for you as long-term smoking.
It's bad.
Yeah,
I understand in the UK they now have a minister of loneliness to assist with the problem, because it is a serious problem, both for cognitive health and for mental health.
Which is not solved, by the way, by how many friends you have on Facebook.
Correct.
Right. This is person to person.
Correct.
And as I read the literature and stuff, you don't need to have lots of friends, but having some good, deeper relationships with people is really important. And so I imagine, too, that's something for those of us who are parenting our parents, right?
Yes.
Encouraging and fostering them to have those sort of engagements wherever they're living.
Absolutely. And sometimes that's a greater discussion if one's elderly parent really is more shut in, not able to get out, about maybe it's time to think about a community transition to more of a senior community or more interactive community. So sometimes that might be a stepping point to making a big life change.
And that's a huge growth industry.
Yes.
And in touring for my parent and my in-laws, my dad is like, boy, there's a lot of places that are, it's different from living in your own house that you've lived in for 60 years, but they are interesting and neat places. I think a lot of people are trying to do a good job in this field. And in Northern Virginia, where we are, there's any number of places at all sorts of different levels of size and extras. And then number 4 on the list.
Number 4 on this list is keeping your mind engaged and stimulated. The best way to do that is learning something new, and so that might be a language, a new style of cooking, cultivating a new type of plant, something new and interesting. But it also encompasses, reading and puzzles, things that are keeping your mind working and problem solving. And again, this is over time, so these are things, hobbies, interests you want to engage in, and things that you want to come back to.
What do you think the role of sleep? We'll end the last few minutes here talking about the role of healthy sleep, because I think that's something that's critical. I think that the advent of all these devices and stuff, and people looking at screens until late at night and being interrupted with devices that ding and make noises and stuff is really disruptive. But let's talk, because one of the things that you're practice has is a sleep center,
That's
sleep and
right,
diagnostic
that's right.
center. So talk a little bit about sleep and quality sleep.
Oh, sleep is extremely important for so many different reasons, but when we talk about cognitive efficiency, our ability to maintain our focus, to do that multitasking, to find that word we want to say, if we don't have a good amount of restorative sleep at night, it's really hard to be at our best the next day. And there is really a growing body of literature to suggest that our sleep may help actually be protective for our brain health. So if we have a lifestyle where we're not getting good sleep, or perhaps we have an unrecognized sleep disorder, we're getting non-restorative sleep, that potentially could put us at some later risk.
There's a lot of good science here. I know I keep saying last question, but this is interesting, and I find this whole sort of brain and wellness and the wholeness to be really important. Northern Virginia, I don't know. Do you have children?
I don't.
Right?
Fantastic
So
nieces and nephews.
So I mean, it's a chaotic, busy place, especially if you're raising kids. You've got school and sports, and everyone's a type A job performer and stuff. So, what is the advice to someone who says, "Gee, like Dr. Bryan, I got your list right. Awesome. I'm way too busy."
Right. Well, like all things, we can incorporate change over time. So if there are a lot of changes that you want to make, so in your lifestyle, if you look at your lifestyle and you want to make some changes, make small changes and make them sustainable. So again, like exercise, do something you like to do. In terms of diet, find something that is easy for you to do. Maybe you get some things delivered. You get your fruits delivered if it's,
Right.
you're
Well,
short
that's
on
another
time.
thing, and so much industry now around that. Like there really is no excuse
You've got so many
anymore.
opportunities.
You have a lot of opportunities.
Exactly.
Yeah. Well, Dr. Bryan, thanks so much for coming
You're
by.
very, very welcome. Thanks
It's
for
the
inviting
Neurology
me.
Center of Fairfax. We'll run the URL and the phone number at the bottom. Highly recommend you give the practice a call if anything that we've talked about has touched you. And thanks for coming by.
Well, thank you very much.